Chronic care management program compliance is under the microscope. But here's the thing, most enforcement cases aren't about fraud. They're about incomplete documentation. So let's review the top compliance mistakes clinics make with CCM and how to make sure your documentation is in order. Hey, this is Miranda from ThoroughCare. We specialize in helping practices manage and stay compliant with care management programs. Over the past year, we've noticed an increasing emphasis and scrutiny on compliance across the care management space. The federal government is increasing its focus on program integrity. They're expecting providers who offer these programs to drive value-based care results, not simply submit claims. It's now more important than ever to make sure you're following best practices regarding compliance, documentation, and billing. So let's dive into key steps to keep in mind regarding CCM compliance. First is to make sure your patients are truly eligible for CCM. CMS requires your patient to have 2 or more chronic conditions and significant risk of decline if those conditions aren't managed. Make sure this risk is clearly documented. You can't just simply imply it. Also, don't skip the initiating visit. Before you can bill CCM for new patients or those not seen in the past 12 months, you need a face-to-face initiating visit where the CCM program is discussed. This can be a separately billed E&M visit or an annual wellness visit. Next, you must get and document patient consent. Your documentation must show that the patient explicitly agreed to CCM and was informed of monthly cost sharing, that only one provider can bill CCM per month, and that the patient has the right to opt out at any time. After the patient has consented and enrolled in the CCM program, make sure to document and justify the time spent on CCM services for each patient. You need accurate records of all the time spent each month and what the time included. Any staff time counted towards CCM must be done under the direction of the billing provider per Incident 2 rules. Remember that if you can't trace it, you can't bill it. Every minute must link to a documented activity. For billing, make sure to bill the right codes the right way. Use the correct CPT code based on time and complexity. Differentiate non-complex versus complex CCM. And remember, only one provider can bill CCM per patient per month. So how do you set your program up on the right path for compliance? First, using a care management software like ThoroughCare takes the guesswork out of many of the issues we've discussed. With step-by-step processes and automated workflows, software can help streamline a CCM program and help with compliance. Next, it's important to develop clear policies and procedures. Staff roles and responsibilities should be clearly outlined, as well as workflow and documentation requirements for the program. Monthly reviews are highly recommended. Consider conducting mock audits and doing internal quality checks. Education and training is key to make sure your team stays up to date on all program rules, regulations, and compliance. If you have questions about your program's compliance or would like to learn more about how ThoroughCare can help, reach out to us at the links in the description below. Please like and subscribe. Thanks for tuning in.